Hi, everyone. Thank you so much for joining us today for a live Q&A about COVID and how it is impacting kids. We are joined today by pediatric hospitalist Sharon Stoolman. Thanks, Dr. Stoolman, for sharing your expertise with us today.
Thanks for inviting me. It's an important conversation.
So important. COVID-19 is so high in our community right now, and we know that there are just so many questions from parents and community members that we wanted to get on here and try to share facts and share helpful information. We're going to cover Omicron versus Delta, multi-system inflammatory syndrome in children, and also share what our offices and hospital are seeing in terms of infection. I did want to say many have submitted questions already to us via social media, and we want to thank everybody who did. And then if we're broadcasting live and you hear, a question you have isn't being asked, please just keep watching. It might be in a few minutes, or go ahead and just put your comment or question in the comments below, and we'll try to get to them. And if we don't, we'll answer them after the broadcast. So let's start with Omicron. There are just so many questions about this new variant. But before we actually, I want to start with vaccination, because they're like this in terms of topics. And is vaccination for 5 and up still the best way to protect your kids against infection from Omicron?
So some people who've already heard me speak will know this analogy, but I like to sort of think of this as, how do we prepare for a hurricane? So if we're in our community right now, we have so much COVID. We're in a huge rainstorm, a huge hurricane. And so we're going to need multiple layers. One of the layers is getting our body ready. So, people talk about vitamin D, vitamin C, eating healthy. And so that's one layer. But then the other layer is having your immune system ready with the vaccine. And so the immune system gets a protein ready that says, if I encounter this intruder, I'll know what to do. And that's what the vaccine really helps us. That's what the flu vaccine. So it doesn't work. It won't prevent 100% of the symptoms. So it's not that you won't get it. It's not a complete barrier. It just says, when I encounter this, I'll have a better ability to fight it and hopefully have less severe infection. So what they have seen with Omicron is that the vaccine is effective. It is especially helpful to be more close to your vaccine. So that's why they're recommending booster shots, that your immune system has the highest level of protection and production of the antibody that they can. And so if you got a shot on Monday and you were exposed on Tuesday, your body isn't totally ready. But if you've had a shot 2 weeks ago, your body really has had a chance to learn how to fight COVID and be at its best chance. But they're seeing that the people who are hospitalized and vaccinated are the furthest away, like 6 months and further away from their last COVID vaccine. And so that's why we are recommending that booster. But yes, vaccination and then masking, and then trying to avoid areas that are going to be significant opportunities to spread or staying away from sick people. So those layers of keeping yourself safe.
You mentioned the word booster, and there has been some news in the last 24 hours about that. So can you share what that new development is?
And I'm really excited that we finally are offering this to 12 to 15. So our 12 to 15-year-olds started getting vaccinated in the late spring, early summer. And so they're about 6 months away from their last shot. And we have seen with Omicron that you need a lot of immunity to be able to face the infection. And so yesterday, the CDC recommended boosters for kids aged 12 to 15. So anyone who's been vaccinated and is more than 6 months out from their last vaccine, we'd recommend a third shot. It's, it's not really confusing, but it's third shot versus booster. It's just getting your immune system revved up and ready to encounter Omicron.
What are vaccination rates for just kids in this pediatric population like right now, whether in our county or state? I mean, where are we sitting?
We have a lot of room for improvement. We're not at 0, but we're not up in that herd immunity area. We're, in that 30 to 50%, depending on the age, whether you're an upper teen, and we're closer, to that 50%, or you're in that 5 to 12, where we're more close to 30%. And then there are different communities that have lower rates. So, I think about, my risk because I live in Douglas County, but I care for patients who live across the greater Nebraska. And so there are counties that have even lower vaccination rates.
Mm-hmm. A big question we received was, when will kids under 5 be eligible? Any idea on timeline?
I know my heart aches for parents, and I have many colleagues who have kids under 5. And the information right before Christmas came out that so what the studies are looking at right now is dosing, and the dose that gives us the good protection and good immunity. And so the adult dose is 30 for Pfizer. We use Pfizer 30 milligrams. The 12 to 18-year-olds receive the adult dose, but the 5 to 12-year-olds were getting a 10 milligram dose. So they dropped the dose down to 1 and 3 for the under 5, and it didn't get enough immune response. And so they have to go back and give a bigger dose and then test. So that puts us into late spring, which is really frustrating for our families who have been waiting for ways to protect their kids.
But so that does give us a sense of where things stand, and
yes, and why it's taking so long. Yes, it's for safety.
We get the question so often, what are we seeing in the hospital? Whether that's acute COVID or multi-system inflammatory syndrome, MISC. So can you just give a sense at this moment, like, what are things looking like, and for you and your team?
Yeah, so the hospitalizations for us are at the highest for acute COVID that they've been for the whole pandemic. So for nearly 2 years, if we think of the pandemic of starting in March of 2020, so we're not quite at 2 years, we are at an all-time high. So we're averaging 6 to 8 patients a day with acute COVID. And that is any age from 2 weeks to 20 years of age. Being hospitalized for different reasons with acute COVID, whether it's acute COVID triggering diabetes, acute COVID triggering asthma, or they actually have more of that COVID syndrome with COVID lung and COVID pneumonia, or dehydration, diarrhea, and dehydration. And then we have 1 to 2 MISC patients a week. And those are really what sounds like a low number, but those kids are really sick. Most of those kids spend at least 1, if not 2 days in the pediatric ICU or longer, with some amount of heart involvement, heart failure, heart muscle inflammation. And so the worry is, once you've had 1 episode of heart failure, we don't know what that means for you 10 years from now, 20 years from now. These kids are recovering really well, which is wonderful and great news, but they're going to be followed by a cardiologist for a lifetime, and we don't really know what that long-term impact is on having had such a significant cardiac episode. So that's a lot of kids impacted for us with COVID. If we think of, most days our service has 30 kids, if 10 of those kids or a third of those kids are hospitalized, something to do with COVID.
When and what should parents look for after COVID as symptoms for MISC? And Alejandra from Facebook had asked, is there a reoccurrence of MISC? And I'm not sure if she meant, like, are we seeing more, or can you get it, multiple times? But yeah, just kind of
great question, Alejandra. Yeah, so MISC is fever that lasts for several days. So usually we're seeing kids with 3 to 4 or 5 days of fever, daily fever every day, higher than 101. They are ill appearing, they have abdominal pain. Many of them have a rash, but not all of them have a rash. They can have vomiting, diarrhea, as I said, just very ill appearing high fever that doesn't go away. And then most of them have had exposure to someone with COVID or had COVID themselves in the last 2 to 4 weeks. So it is what we call a COVID complication. So they may have had a very mild COVID illness where they had 1 or 2 days of cough, runny nose, got better very easily, and then a couple of weeks later developed this fever that won't go away. And it may come down with Tylenol, but it comes right back. It may come down with Motrin, but it comes right back. And they don't really have any other findings. So we check their chest x-ray and they don't have a pneumonia. We'll check their urine and they don't have a urine infection, but they have very abnormal blood work. And then often after we've admitted them, then they have low blood pressure like sepsis, and require a lot of fluids and some of them blood pressure medicines.
Wow. And in terms of a reoccurrence?
Oh, recurrence. Yeah. So we have had not quite 100. We've had a little over 80 kids since the start of the pandemic in Nebraska. So at Children's alone with MISC. We have what we call refractory, which isn't recurrent. It's just that it takes a little longer to go away or takes multiple doses of the medicine to go away. But we haven't readmitted a kid with MISC. So I think that so far that's not been played out in the literature as recurrent MISC, but you wonder when you've triggered the immune system so significantly, could it be triggered again? So I think the answer for Alejandro is we don't know. We haven't seen it in 2 years, but I don't think that means that's a no.
Sarah from Instagram had asked, what are the symptoms of the Omicron variant in kids? Do they differ for under 5 versus an older child or teen? And then I think this is kind of a related question. You know, so much going around in a typical season. So it's like, is it COVID? Is it cold? Is it flu? Can you talk kind of the symptoms? Yeah.
Yeah. So what I think is interesting about Omicron, and so when you look back, and I think back to 2 years ago in March with what we call the original alpha strain, was that there was an incubation period that was longer. So usually you're exposed to something and in 1 or 2 days you get symptoms from your exposure. I'm exposed to food poisoning and within the day I'm vomiting. I'm exposed to someone with a cold and then the next day I have a cold. But what was different with the alpha variant was you were exposed and then there was about a 6-day delay before you had symptoms. But then when you had symptoms, probably 2 days before that, you were contagious. And so that was the really hard and frustrating thing with getting control of the alpha variant was before you had symptoms, you were contagious, but there was this long period. Omicron is acting more like our typical respiratory viruses in that you have a shorter incubation period. You're exposed, and most people within that first 3 days after exposure have symptoms. And their symptoms are sore throat, fever, sneezing, congestion, body aches, headache, back pain. Our kids are just grumpy, because sometimes they're not as verbal. They're not able to say my throat hurts, but they're not eating as well. They're not able to say that my back hurts, but they're just grumpy and they feel terrible, and they have fever. So you're right. Does that sound like influenza? Yes, because when we think of influenza, you have body aches, high fever, congestion, sore throat, and we did not have influenza significantly in the community last year. This year, we have a high amount of influenza A. I haven't seen B yet, but we have a high amount of influenza A. And some of that may be that we've been so focused on vaccination for COVID that we didn't do a great job of vaccinating for influenza. Some of it is a little bit in that every year we make a good guesstimate of which strain we're going to see for influenza, and we missed a little bit on the strain that's in the influenza vaccine. And then I think that pandemic fatigue, that we're out there and we're sharing viruses, and we're not masking, and we're going back to restaurants and ball games and the things that we need to do as humans. So there's adenovirus in the community.
There's a lot going on.
There's a lot going on.
And with that, if I'm a parent and my child has some symptoms, which kind of fall under maybe 2 of the however many categories, Katie had asked, when should I get my child tested? Like, when do you kind of pull that trigger and be like, yeah, it's time?
So I think the one thing that's very challenging for us is trying to figure out risk assessment for your family. So, you know, if your kid is symptomatic and has fever and is homeschooled or doesn't go to daycare, and the adults are vaccinated, is it essential for you to know if your child, if they're getting better and the fever is only lasting 2 or 3 days and they're still eating or at least drinking and not dehydrated? It's nice to know that if they have COVID, but there isn't a treatment that's going to impact it. So it's not like we could test and then have a medicine to give. So it becomes more, what is the risk of COVID for your tribe that you're around? So does grandma live with you? Have you recently been at daycare and exposed, you know, the classroom of 18? So I think it becomes a little bit of, is it important for us to know because we have put other people at risk, but not because we can get a medicine that can, like, you know, when you get strep throat, it's really nice to be able to go in and get a strep test and be able to say, oh, I have strep and I got my penicillin and I feel better. Or even with influenza, I go, I get my influenza test, I can get Tamiflu and I feel better. That's a little bit harder. The other part is that we ended our pandemic funds in July, so our testing sites aren't the easiest to get at. And so, you know, it's hard to justify, am I going to wait with this sick kid in my car for 2 hours to get a test? And so I think as a parent, I'm going to try to get information, but I'm not necessarily going to put my child at risk or by sitting in a car in 5-degree weather to get a test. So yeah. That's hard. So I don't have a perfect answer for Sarah, except for that it's helpful to know if you are worried about whether you've put other people at risk, or if you're trying to figure out when can we go back.
I love this question because it's just what I've been wondering. This, speaking of testing, you know, Aaron submitted a question. Why does some PCR tests go way up the nose? You know, those ones that you joke like hit your brain, while others just need to go 3/4 of the inch. And you know, that's really relates to kids, because you do need to kind of sometimes prep the child for like, okay,
here it goes.
Here's what to expect. So
yeah,
the difference.
Well, so accuracy is better if we get a deep nasopharyngeal sample. So that is where the virus is replicating. And so PCR tests generally need to be not in the anterior part of the nose, but in the posterior part of the nose. Antigen testing can be in the anterior part of the nose or in the saliva. So when you are doing like those spit tests or anterior nose, you're getting an antigen test, which has a lower sensitivity. So the accuracy goes up when you get the way back. What we joke, it's not, but a brain biopsy. Right. I mean, it feels like it, and your eyes water, and it's intense.
Yeah, it is.
Yes. So I hope that our technology improves and that we'll move towards posterior pharynx swabbing. But right now, the most accurate test is that deep nasal pharyngeal.
So if a child gets COVID, the Omicron variant, right now, what are the medications or treatments that you and your colleagues are recommending? And I think this is kind of a hard question.
Yeah, so we symptomatic and supportive care. So hydration, making sure they're hydrated. Fever itself is not dangerous, but it's uncomfortable. So we treat the fever for comfort so that you can tolerate, you know, eating and drinking, but it's not causing your body injury. It's actually your body fighting the virus. So Tylenol and Motrin. The monoclonal antibody that was very helpful during the Delta variant and even for the Alpha variant has not shown to be effective against Omicron. So as of yesterday, we are no longer using monoclonal antibody for treatment of children with significant risk for severe disease. So we don't have a lot to offer. Remdesivir is still the standard that we're using for kids with respiratory parts of their acute COVID. So if you're on supplemental oxygen and you're hospitalized, and then for that COVID pneumonia, people are using Decadron or a steroid medication to help with the inflammation, because the SARS-CoV-2 virus is very inflammatory. It makes a lot of things get irritated and inflamed. So the steroid helps.
So let's say I hadn't gotten around to getting him vaccinated. I've been kind of wait and see.
Mhm.
Now I'm ready. How do I do that?
Well, and I think that's going to be a lot of people right now, Sarah.
Vaccinated.
Vaccinated. I think it's a lot of people who said, okay, there was, of course, the pediatricians and who have kids who ran out as soon as they were approved in October and went to, whatever communities had. And then there were other people who are justly just looking to see what's going to show up? What are the other side effects that might show up that we'll see? So we've had almost 6 months, and this dose was right on. So the 5 to 12-year-olds dose of 10 milligrams with 0 cases of myocarditis associated with vaccine. So that the vaccine is so safe and very effective. And so to me, vaccines are something that pediatricians do. So most people will go to their pediatrician's office. So you'll call your pediatrician's office to make a nurse-only visit for a vaccine. And that way, if you have questions or you just want to make sure that if there are side effects, you're in the office. But for some of your really, easy kids, I don't have those. You could go to the pharmacies and they're, good at sitting and they're not going to cause a fuss. You can go to CVS and Walgreens and the Hy-Vee and make an appointment. There's also a walk-up clinic at the Lawrenson building for UNMC. But I think for most of us, we're used to getting our kids vaccinated at our pediatrician's office. And so call and make a nurse-only visit for the appointment.
Earlier we talked about flu. You said that flu vaccination was down, and it's been a couple weeks since we reported this, but I know in our children's physicians' offices, it was like 32% down. And I know there's been some hesitation about getting the flu shot and the COVID shot to, if you were in that 5 and up range, like together. Is that a myth to dispel? Any information about the safety of that, getting both at the same time?
So there's no scientific reason to not get those shots at the same time. Your body can handle and understand what to do with both vaccines at the same time. I think many of us adults didn't feel great with our COVID vaccine. And so we were hesitant to have our kids also feel terrible from their flu vaccine and their COVID vaccine. But what we've really seen with kids is they really aren't, maybe they're just used to getting vaccines, but they don't really have that 2 days of fever and malaise, and or maybe it's the 10 milligram dose, but they seem to really do well with their vaccine. And so I also know, as I'm a working mom, that we're busy. So if I get a captive audience in there, just like when my kids were younger, I want that we're just going to do the shots. We're going to do it, and we're going to reward, and we're going to have a great treat. Unfortunately, I reward with ice cream. I don't know, shots were always an ice cream thing. And so, yeah, there's no reason not to. And I would highly support you doing it. And then, being able to celebrate where we're protected, because it's hard to get them back after you've given one shot. Then we're going to go back and get another and have to negotiate that. And I don't have that. After 2 years, we're all just doing our best.
Yeah. So if you're watching this, schedule them. It's not too late to get your flu shot. Do it both. Call your children's physician's office or your pediatrician. Another question, what would you say to someone who says, my child's already had COVID, why do they need the vaccine?
Yeah, and that's a common question for adults and kids. Why do we need that? And so a lot of the data for this comes out of University of Nebraska, and that is that if your immunity after your COVID infection is here, and then after vaccination is here, and it's up here after both. So like you're almost superhuman if you've had COVID and vaccinated. But what we're seeing with Omicron is that prior infection with Delta or Alpha is not protective for the Omicron variant. And that's why when we're talking about the vaccine that we need people boosted, is that the Omicron with the mutations that it has, it's really contagious, and you need a lot of antibody. And so you need more than your natural antibody that you got from your Delta infection to be protected. So it is not that you have zero protection from having had COVID, but it's not enough to protect you from a serious infection with Omicron.
There continue to be concerns or questions about the COVID-19 vaccine and fertility. And, we just want to share facts and address it
Yeah.
head on. So tell us, what do we know on that issue?
Absolutely. So, the first thing I'll say is that the American College of Obstetrics the OBGYN organization is 100% behind COVID vaccine for women who are pregnant, who want to become pregnant. The studies have looked at, so initially they did not include pregnant women in the vaccine study, but people were not told not to get pregnant, and people did get pregnant in the original study with the vaccine. So I will just say that it does not, there's no evidence that vaccine affects fertility. But then I just had to go back and look and say, where did this come from? Like, all good concerns come out of something. So where did this idea that this vaccine would cause infertility? So I went to look and dig, where did it start? So it starts with a physician who speculates that the spike protein in the mRNA vaccine may be similar enough to the placenta protein that you would be attack a placenta. But the spike protein is also on the coronavirus. So if natural infection doesn't prevent fertility, then vaccine should not. So the spike protein is part of coronavirus. So it wouldn't be just the vaccine that would impact fertility, it would be coronavirus infection. But then what they've seen is that there are maybe 4 parts of the spike protein of maybe, let's say that if there's 20 DNA things, there's 4 that are similar, so it's not similar enough. So the speculation, that physician even came full circle and said, it turns out it's not enough. But it was already out of the box. Like, the question was already asked. And so then it became, people took hold of that and said, well, that's too much of a possibility. But 2 years later, we have not seen an impact on people who, if 20% of our population or more has had coronavirus, we're still, our fertility rates in the US are still good. And then we are a year out from our COVID vaccination, and we have looked retrospectively, and there's not a difference in miscarriages or preterm labor or fertility for women. So I understand the concern, because you're right. For us, one of our riches is our children. They are precious cargo. But you have to be here to have children. And so it's important to remember that people are dying from coronavirus. And so we want you to be here to even have that discussion of fertility and to feel. So I understand that fear that's there, but the numbers and the safety say it is not a problem. And so, when you're giving it to your 12-year-old, you're not changing their plans for their life on whether they want to parent or not. When you're giving it to your 5-year-old, we're not changing their plans for parenting.
I love that you brought it home to that. I mean, that's why we're having this conversation. That's why our organization exists, because children are precious and we want to make their lives the best they can be. So let's shift, we've been talking, infection and variants into the school conversation. And yes, we are still talking about masks.
Yes.
We've had this.
We love wearing masks.
Oh, don't we? A question came in: should fully vaccinated children still wear masks in school? Well, I could do a 2-parter, but let's just stop there. Should fully vaccinated children still wear masks?
Yes. So that vaccine is one part. So that vaccine may be your slicker and, rain pants, but that doesn't keep your head dry. That doesn't keep your feet dry. And so the mask is another part of the layer. The other thing is that we're in the classroom. We need them in the classroom. So we have some great data that came out after some testing came back in November that said that remote learning didn't work as well as, we did the best. I could have told you it wasn't the same. I'm not a teacher. I bless the teachers and really respect the teachers, but I could have told you I was not doing the same as they were. And so now we know they have to be in the classroom. So how do we keep them in the classroom? Again, we're talking about that pre-symptomatic phase. So it'd be perfect if we could swab everyone every day and know that the minute you walked in the building, you didn't have COVID. But even when they've tried that and they've done testing before parties, somebody had a little bit, and they had a Christmas party in, I think it was Norway, it was in one of the northern countries, and they had a majority of them were vaccinated, 80 people were there. They did pre-antigen testing, and 70 of them still got COVID. So, and that was Omicron, because that's how fast it goes. So the reality is we can't predict that everyone in the classroom is negative. In fact, we know that a good number of them that are in the classroom are probably shedding or have some level of asymptomatic virus. And so how do we keep the ones that are negative there? We wear a mask.
So keep buying those cute masks.
Yeah, so then the question is, which mask? Which mask?
That is the second part from, Allison from Instagram had asked, okay, so what kind are best for school age kids? And, you know, someone had mentioned K95. There was some other K number.
KN95.
Maybe was there a 64? Anyway, what is the best kind of mask for a school age child right now?
So I will start with a mask is better than no mask. We're now learning with Omicron, because it is so contagious, that the cloth masks are just not adequate. That being said, there are a lot of surgical masks that aren't great either. I've ordered some from Amazon, and they come and you just put them on and immediately know that's not a good one. So we do want 3 layers of, and so a disposable mask is what I should say. The short answer is a disposable mask. They have kid versions of N95s, the K95s that are more comfortable for kids. They're just kind of pricey. And so I think getting a good 3-layer disposable mask for kids is great. But I will then again just say a mask is better than no mask. So what you can afford, if reusable, is better. It's hard for the environment. We've done some damage in this last 2 years for the environment. Yes.
Yeah. I have to tell you that Mary on Facebook says, this is just a little shout out, you're the best. Thank you. I was supposed to see this today. I'm scheduling my son today for his first vaccine, and then raise the roof emoji.
Yay. It's hard. I mean, I remember bringing my child home from the hospital thinking, they really think that I'm ready for this. Like, okay. And, you know, every decision we take very seriously. And so vaccines are serious, and that's our job as pediatricians, is to do the reading and to do the literature search and to be able to say to you, yeah, this is a good one, and it's a good idea, and we want to be there for you. And that's why I think it's probably best to get it at your pediatrician's office, so that if last minute questions come up, you're there. But if you, again, have that great kid that's going to sit in the chair and not fuss, then you can go to Hy-Vee, and then you can just get your ice cream at Hy-Vee.
Go in the freezer aisle.
Right, in the freezer. Save some money.
This has been wonderful. So much good information shared. I guess, and thank you again to everyone who shared questions, either here live or beforehand. Dr. Stoolman, just to close, I mean, any other things you would say to parents who care deeply about this issue, they want to get it right, or anything else you want them to know?
Well, I guess what I would say, which is, you know, we did have a cushion that first year where our kids seemed less impacted. Shouldn't say less impacted, because they were impacted by a lot of the pandemic policies. But I have really taken note that we are seeing in the emergency rooms, in the hospital, lots of kids with COVID, and lots of kids who are vaccine eligible, whose parents were just not quite ready. And so I would push you a little bit to say, we had some time to wait and see, but now we are really in the thick of it. Our coronavirus numbers, and hopefully it'll be like South Africa, where we have a rapid peak and a rapid low, but We want everyone to be able to weather the storm and really come out whole at the end. And so if you're able to get in and get a vaccine, it's a great time. If you're still nervous, we want to talk to you. But I don't want to. And the one thing I will say is that we have not seen kids with MISC who were fully vaccinated before their coronavirus infection.
Mhm.
So we have had one kid who had a vaccine after his coronavirus infection, but we haven't seen any MISC from kids who were fully vaccinated before their COVID infection. So it nationally seems to be protecting against MISC. And that's the really scary one for me. I think kids are, they're a lot more resilient in recovering from acute COVID, but that MISC really scares me. So we want to be there for you to get that shot and to get that prevented. And I think the other thing is our nurses and RTs and CNAs and LPNs are really exhausted. And so doing what we can to help prevent hospitalizations will help us all.
We did get a question just now from Mary Ann. My son won't wear masks, but is vaccinated. He's 8. We're scheduled for appointments. This sounds like a patient family, perhaps. Yeah, I'm assuming that, but we're scheduled for appointments later this month. Should we keep our appointment or reschedule for when COVID is not so bad? We travel from South Dakota. I know masks are required.
Yeah, so you can't, and so we have, but so there are some patients with autism or some sensory issues that the masking is really hard for them. So I would call ahead to see if you can, you're going to come in and be put right in a room versus wait in the lobby. So I wouldn't reschedule your appointment because we tried that and people got way off schedule on their medicines and things that needed to be seen. So I would say to call ahead and to say, we are doing our best, but the mask has just not been working for us. And so our appointment is at this time. Should I wait in my car and have you text me when it's time to come up? Again, we are doing our best. So there are, we're not gonna, we don't want your child not to get the health care that they need.
Yeah, well, good question, Mary Ann, and
yes.
great guidance, Dr.
We keep fighting the fight. Yeah, it's so hard.
I also wanted to point out the Max the Vax initiative that we have going on. It's a statewide initiative to get kids vaccinated and protected. It's a website with tons of great resources and information on the where can I get my kid vaccinated, not just in Omaha area, but statewide. It's maxthevaxne.org. So wanted to put that in there too. Dr. Stoolman, you've been incredible. Thank you for advocating for kids.
Thank you, Sarah, for this opportunity.
So grateful. We hope this has been helpful to you.
Absolutely.
Keep the questions coming, and thank you for tuning in. Take care.
Thank you.